We will talk about neck pain. It affects almost everyone at some point of their life. That's why it's important, and we will explain most common causes of neck pain. Most common cause is muscle strain and sprain. What it means? When you overuse or repetitive neck motions causes minor damages in muscles, it causes micro traumas in muscles, and it put pressure on joints, it put pressure on spinal joints, vertebrae, and causes inflammation, and it compresses nerves, and we feel pain. That's why overuse and repetitive motions causes neck pain due to muscle strains and sprains. Such condition is, for example, computer sludge, when person continuously and sitting for prolonged period of time to computer. In this case, this boy has muscle strains and sprain. Another example is lifting heavy objects. When person lifting improperly heavy objects, he has muscle traumas and neck pain also. Or another example is sleeping in awkward position. When you wake up with neck pain, it's also a common scenario. This type of pain is stiffness or aching, and it is exacerbated when you're moving your head, and usually it affects only one part of neck, but both part involvement also possible. Pain usually peaks in first 2 days, but sometimes it can last longer, but after 2 days it resides over time, and in a week it almost completely resolved. Now let's say about treatment. What is mainstay of treatment? It's ibuprofen, which is anti-inflammatory non-steroidal drug, or naproxen, another anti-inflammatory drug, and acetaminophen. Acetaminophen is recommended for people who has gastrointestinal problems and they can't intake ibuprofen or naproxen because acetaminophen does not have anti-inflammatory action. It has analgesic action but not anti-inflammatory action. That's why ibuprofen and naproxen are more effective. Also, gentle stretching or massage also help. From topical creams, menthol containing creams are effective because they causes cool sensation in the neck, and actually this sensation mixed to pain, and pain resides some degree. That's why menthol is effective. Capsaicin contained creams are effective also, but at first they causing heating of tissues, and then pain resides because they affecting P receptors, which are responsible for pain transmission. And diclofenac cream is effective also. It is non-steroidal anti-inflammatory drug, but has less systemic effect compared to naproxen or ibuprofen, for example, which are intaken orally. And ibuprofen cream is also effective, and it has less side effects, of course, because you're using it locally. Now let's say about second most common cause of neck pain is osteoarthritis. Osteoarthritis, also known as cervical spondylosis. Also, it is known as cervical osteochondrosis in some countries. And what happens at this case? At this case, over time, when person is aging, the vertebrae are degrading. They are degrading. They lose elasticity. They losing function. They compress nerves because of inflammation, and pain occurs. And our vertebrae tries to stabilize spine, and it causes bone growth, and this bone growth is bone spur, and it additional causes destruction and compressing of nerves and causes additional pain. So these bone growth spurs or osteophytes, they are called also osteophytes, are a pathological sign of osteoarthritis, and it can be seen in computed tomography or X-ray or MRI. What are the symptoms of cervical osteoarthritis? Is muscle stiffness, pain, and sometimes nerve compression. If nerve is compressed, then pain can irradiate to hand and arm and cause numbness in the arm and pain in the arm or tingling in the arm because of this radiating effect because of compressing nerve. And what causes osteoarthritis? Most common cause is aging. Over time, this vertebrae wears and tears and degrades over time. That's why osteoarthritis develops, and it's not isolated on vertebrae. Of course, it affects other major joints also, especially hip joints or knee joint. And other causes can be heavy lifting, trauma, or genetics, and people say that they have grinding or popping sensation when they move their neck, and it worsens with movement. It's important that person will say that his pain will worsen with movement. X-ray, MRI, and CT scan are used for diagnosis. And pathognomic sign is presence of bone spurs. It means bone growth, additional bone growth, which is pathological. Now, what is treatment? Major treatment of osteoarthritis is exercise, and I can say very simple exercise: placing a hand on the forehead and push your head against the hand without allowing head movement forward, and keep this position for 3 to 5 seconds. Then do opposite, back of the head, then right of the head, then left of the head. Same type of exercise, and do it 2 to 3 times per day, and it's effective treatment. Or another effective treatment is just stretching your neck, like you can do like this. You can bend your head backward or forwards, then right and then left. It's also effective, and do this also 2 to 3 times per day. It's simple but effective exercises. From medication, naproxen and ibuprofen are first line treatment. Sometimes muscle relaxants also used, like cyclobenzaprine, for example. But it is used in severe cases when first line treatment is not effective. And in severe cases, also corticosteroid injections can be solutions, such as methylprednisolone or dexamethasone in epidural spaces. Surgery is last resort. If there is no other solution, then surgery can remove this bone growth, and it can decompress spine, and surgery usually helps also. Now let's say about third most common cause of neck pain. It's herniated intervertebral disc. It is also called cervical radiculopathy. What means cervical radiculopathy? Over time, our intervertebral discs, these ones, are degraded, and they are damaged, and they release their inner substance, and this substance causes inflammation around it, and this inflammation causes compression of nerve roots, and we have symptoms, and these symptoms usually radiates to arm, to hand, and person feels not only pain in the neck but also feels numbness and tinglings in the arms, in the hands, and very rarely in the leg also. It's not direct effect on leg, but sometimes person can perceive pain even in the leg. It's also possible. What is the most common cause of cervical radiculopathy? It's age-related degradation in many cases, or trauma. Trauma can be lifting heavy weights, or it can be accident, and it can be acquired movement. Different types of trauma can cause herniation, and symptoms usually are sharp and burning sensation and radiating tingling sensation to the arm, shoulder, and head. Treatment is same: ibuprofen, naproxen, and acetaminophen is classical treatment, but sometimes prednisolone and methylprednisolone are used, oral forms, but they should not be used for extended period of time because of many side effects, because of they can cause weight gain, for example, increased appetite. They can cause high blood glucose level. They can cause fat distribution problems. So they have lots of problems. So only short-term period of usage is correct if you use prednisolone or methylprednisolone. And sometimes muscle relaxants such as cyclobenzaprine also used, but it's also in severe cases. From topical creams, capsaicin, diclofenac, ketoprofen, ibuprofen, and menthol containing creams also effective to cope this pain. From supplements, glucosamine and chondroitin is used for spinal joints. They can have some effectiveness. Omega-3 also effective because they have anti-inflammatory effect. Calcium and vitamin D are also important for bone health. And now let's say about other causes of the pain. They can be pharyngitis, physical injuries such as whiplash, for example, rear end car collisions, rheumatoid arthritis, spinal stenosis, and rarely meningitis and tumors can also cause neck pain. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.